Good morning. My name is Vandana, and I will be explaining the clinical manifestations with which Mr. Smith has presented with. I will have an introduction, a body, and then follow up with a conclusion. Did you know that over 2.5 million people, about 1 in 9 Australians, suffer from asthma, children being the most common? So I will just share my screen with the presentation I have created. So what is asthma? Asthma, according to the National Institute of Health Guidelines on Asthma, it is defined as a chronic inflammatory disorder of the airways in which many cells and cellular elements play a role. In particular, mast cells, T lymphocytes, macrophages, neutrophils, and epithelial cells. The inflammation causes recurrent episodes of wheezing, breathlessness, chest tightness, and coughing, which is usually at night or early morning. These episodes are usually associated with airflow obstruction that is often reversible or relieved by treatment. Maternal and childhood anxiety, which correlates with stress in early life, has been associated with the risk of consecutive respiratory disorders. This includes the episodic wheeze and asthma. Individualized coping mechanisms and environmental risk factors, such as outdoor air pollution and cigarette smoking, are likely to result in the physiological changes that influence asthma. In John's case, he doesn't state whether he smokes, as his description he presented with is very limited, but he is an adult now, and it is likely that he may be a social smoker or mingle around with people who may smoke. And of course, this will compress the risk of asthma. So this is a photo from National Asthma Council of Australia. It portrays a good description of what happens inside the lungs when someone with asthma has the symptoms. The airways tighten up, as inside the wall of each airway there is a thin layer of muscle, so that when it contracts, it makes the airway narrower. This is where the relieving medicines work, as it relaxes the muscles in the airway. Secondly, when the airways thicken up, the lining of the tubes gets swollen and inflamed, which then leaves less space to breathe through. This is where preventive medicines work, as it reduces the inflammation that causes swelling. And thirdly, when the airways fill up, the inside of the tubes can get blocked by the mucus. All the symptoms can happen at the same time. So the pathophysiology that lies behind asthma can be categorized into two categories: cellular inflammation and tissue remodeling. Cellular inflammation is the inflammation in the lower airway, which most likely arises from a combination of genetic predisposition, environmental exposures, and possible alterations in the microbiome and metabolite. Whereas tissue remodeling is a plethora or pathological alteration which occurs in the lower airways. This primarily occurs in the mucosa and submucosa. Pathological changes in the mucosa include the epithelial hyperplasia and metaplasia of goblet cells with increased mucus production. But in the submucosa, smooth muscle hypertrophy, collagen deposition, and larger mucus glands dominate the changes seen, leading to narrower airways and increased mucus production during asthma episodes. That is just a little bit of background information on asthma. Now let's look at the clinical manifestations that John presented with. So dyspnea is a breathing discomfort that consists of distinct sensations varying in intensity. Patients who live with a respiratory disease experiencing dyspnea can lead to increased stress, anxiety, and depression. Even though the relationship between dyspnea and anxiety is unclear, there are studies that have shown that dyspnea is common against people experiencing anxiety symptoms. Average respiratory rate for an adult is between 12 to 20 breaths per minute. As John's breathing rate was quite high, it could mean that he had a bronchial obstruction due to asthma. The airways in asthma is typified by reversible airway obstruction and even partially reversible inflammation. The hyperactive airways demonstrate chronic inflammation, bronchial edema, and wall thickening. In patients with severe or chronic recurrent asthmatic symptoms, bronchial wall thickening is a common response of the airways to irritants, causing the bronchi to become swollen and inflamed. So the average heart rate for an adult is between 60 to 100 beats per minute. John's heart rate was quite high, as the heart was pumping 130 beats per minute. It seems that John's heart was pumping more blood because he was struggling to breathe, as his breathing was quite inconsistent. The control of heart rate is modulated by the respiratory cycles as physiological, which characterizes by the changes in heart rate due to breathing. When taking a spontaneous breath, a synchronic interaction occurs between the respiratory phase and heart rate control. Since asthma results in changes in the respiratory cycles, it is expected that it may affect the autonomic control of heart rate, even when asthma is being controlled. So John had an auscultation of the lungs that identified his diminished breath sounds. So auscultation is an effective technique in acknowledging the condition of the respiratory system, as it uses lung sound signals that can convey valuable information of the lung status. This procedure works greatly on detecting the severity of wheezing. So the chest X-ray results has shown that John has clear and hyperinflated lungs. The assessment of hyperinflation is initiated when a reduction in expiratory flow leads to incomplete exhalation due to the tidal volume. As the lung increases with subsequent breaths, higher elastic recoil pressure and larger airway diameter augment expiratory gas flow, and a new steady state is quickly reached, at which of the time the entire tidal volume can be exhaled. Therefore, the impact of a ventilator is a critical determinant of hyperinflation for the severe airflow obstruction. Since the flow of oxygen decreases through expiration, the impact of a ventilator will help regulate John's respiratory rate. So, thank you so much for listening and for giving me your time. Based on the presentation that I have presented, it is clear that asthma is a critical illness, and the clinical manifestations that I have stated need to be looked into accurately in order to diagnose the right options for John's health and well-being. So thank you for that.